Larson with the COVID-19 update. So through the weekend, we continued to get positive cases from our current outbreak at Twin City Foods. We are currently up to 59 cases, and all of the people that we have that are positive are all related in some way or another to Twin City Foods. We're still testing. We're still expecting to have more cases. None of those people have been hospitalized. The youngest of all of those patients was 10 months old, and the oldest of all of those patients was 66 years old. So they're doing well. Twin City Foods has done a really good job of getting ready to reopen again. They are reopening tomorrow, Tuesday the 19th, with patients that have recovered or were negative, and they are going to have mandated masking, so mandatory masking at their facility to protect each other. So we see now that even in a facility that has a really good safety plan, it's really difficult to keep disease like COVID-19 from spreading amongst employees. We can put up barriers, we can do hand washing, those things are all important. What they hadn't done before was had mandatory masking, so we're going to try that. They want to stay open, they want to protect their employees, and so as we move forward, you're going to hear a lot more about masking, because we are finding out that when we have enough people in the community masking, it allows probably better control of the virus than even doing contact tracing and investigation. Currently, we are contacting all of those folks that were in touch with folks that were positive. Some of those people have gone in and were tested. Obviously, a 10-month-old does not work at Twin City Foods, but is related to people who work at Twin City Foods. And we will be testing all of those folks on Thursday of this week. All of the contacts will be testing on Thursday in a drive-through clinic to allow us to know how well we've done with this outbreak management. I have to give Twin City Foods an A in regards to how they've dealt with their employees and tried to keep their employees safe. They are helping their employees file for unemployment insurance and those type of things. We have had some fraud, not with Twin Cities, but just fraud in the United States with people applying for unemployment. So there's been a little bit of a glitch there, but they're working really well. I just spoke with their human resources manager just a few minutes ago. In regards to the variants, so the variants was put on pause, because we have an outbreak at Twin City Foods. We did put in a report to John Wiesman on Friday evening saying this is how we've been doing, and the county commissioners, along with lots of supportive people in the community, wrote a letter saying, we really feel like we've done a good job. Corey Wright was the primary person who penned that letter to the governor and Secretary of State Wiesman, and he did a really good job writing the letter, and it was signed by the hospital CEO, the CMO of the hospital, the president of the university, and others. So we got a response to that. That response was, we need to look at what the incubation period is of the disease. So that is 14 days. So that takes us through to Tuesday of next week. I believe that's Tuesday the 26th. We will have another report for Secretary Wiesman at that time. We will be able to tell him how many contacts actually came down with the disease, what the demographics were, and Secretary Wiesman said he would address our variance request at that time. So that's where we're at with the variance. In regards to masking, I spoke about masking a few minutes ago. Masking is important. King County has a mandatory mask policy currently that went into effect today. It was a directive from the health officer stating that anytime any of us are outside or inside a business where we cannot maintain 6-foot social distancing, we need to wear a mask. That went into effect today. we can expect this week to have a mandatory mask directive come out of Spokane and probably one out of Yakima. So as we see that works, protecting employees as well as protecting customers, I think people will become more used to that being the norm, and will realize that we can move forward on our variance request and move forward from, when we move forward from 2 into 3, those things are going to keep disease down, and they're going to allow us to move from 2 into 3 and 3 into 4, and then we'll be able to be back to some semblance of normal life. Lots of cuts to government services. DSHS is getting a big cut. Central Washington University is getting a big cut in this coming budget. So a lot of work to do there. I'm going to take some questions.
Let's start with some masking questions. So there was questions about, for those that aren't able to wear a face mask, what are your feelings on using a clear face shield?
So face shields are helpful. We use face shields in the hospital to protect from splatter when we're innovating, putting a tube down someone, or causing something that you're going to generate a lot of droplets. So those face shields are more to protect us from others. So you might see somebody at the grocery store that can't wear a mask that's wearing one of those. They don't really do as much to protect others from us, but they do some of that. They can be cleaned easily on an everyday basis. We have some difficulty with obtaining those things. They can be printed on lots and lots of there's lots and lots of different ways to make those, and people are making them themselves, just like they're making masks. So they can be used. They are going to be using some of those at Twin City Foods as well, for people that can't wear masks. And I think one of the other questions was in regards to heat. When it gets warmer, would those be better? And the answer is yes, probably, for those, especially for those indoor businesses where it's super hot inside and they can't really tolerate wearing a mask. Again, the mask is to protect others from us for the most part, and the face shields more protect us from others. So they both have value, a little bit different devices.
When you say that a person who tested positive was asymptomatic, does that simply mean they didn't have symptoms at the time the test was taken, or does it mean they never developed symptoms over the course of their illness?
So those people that were considered asymptomatic did not have any symptoms up to the time that they were tested. Now, as we follow some of those people along, some of those people do develop symptoms, but some of them, even some of the folks at Twin City Foods, did not have any symptoms throughout the course of their illness. So it has seemed to be the minority in our current outbreak. That is, very few people at Twin City Foods were asymptomatic. Most of them had cough, shortness of breath, loss of taste and smell, nasal congestion, sore throat, and headache, muscle pain. So, and we're still testing some people from Twin Cities.
Isn't it true that the more we test, the more positive cases we'll find? Shouldn't we be gauged by how we handle the cases instead of being case-free for 3 weeks?
I have to agree with you totally. So yes, the more we test, the more cases we're going to find. So that's definitely true. The 3-week no case definition is probably unrealistic for anybody that has had an outbreak, because we know that we're going to continue to have a trickle of people that remain positive that are somehow connected to Twin Cities. So, but we don't expect those numbers to be high. So yes, we should be judged by how we react to an outbreak, what kind of hospital services we have, whether the hospital feels like they can do the things that are necessary, whether we have enough personal protective equipment, whether we have enough ability to do swabbing for COVID-19 testing, whether we're able to do case and contact investigation and isolation and quarantine. I have to let you know that no one in our current outbreak setting has needed to be isolated or quarantined outside of their own home. So we haven't had to use any kind of facilities other than encouraging people to stay home. We have delivered some food to some of those folks. So that's worked really well. There is a whole